Empty hearts and neon lights. They're playing with my mind.
Hey guys, and welcome to day 51 of making videos. Just past that halfway to 100 mark. I'm Alexander, and today we're just going to be talking a little bit about how different people wake up from anesthesia and some of the fun activities we get up to. There's about, I think, 3 or 4 or 5 types of people who wake up from anesthesia. And the first type is the most boring type. Just wakes up, normal person, everything's cognitively fine. These people often haven't had long surgeries or big complicated procedures done, and they're just a normal person to react normally. That is the most common. The next most common is the type of person who wakes up completely out of it and high and just slightly off key. They giggle a little bit, they are looking around and you can tell they're seeing things that aren't always there. Sometimes they'll verbalize this in the early stages, like we had an African American lady who's, why are those elephants hanging upside down over there? And obviously they're not. These cases happen when people are, all the subsequent cases, more people under more serious procedures, much heavier dose of anesthetic. Sometimes people are allergic to more of one of the more common drugs like Versed or Dilaudid. So we end up having ketamine, which is essentially a horse tranquilizer, and as you imagine that has effects on people. It's not dangerous, it just mentally messes with them a bit when they wake up. We see a lot of people who wake up who are just very emotional. You know, you guys are the best, and I love you guys so much, and you dedicate your lives to saving people. You know, a lot of crying, a lot of gushing. Nurses like these types of patients because they're very complimentary. You know, I just can't believe you spend your whole life helping people, and you guys are such sacrificial. You do so much. And they're a nice patient to have. They can get emotional and annoying, but they're pretty nice. We get people who seem to unburden themselves. It's almost like the opposite. Just they're very talkative but not emotional. These people will tell you anything and everything, and it's because I think some of the drugs are still in their prefrontal cortex, which controls what you, more the front of the brain here, which controls what your sort of, I don't know how to put it, but normally it controls like what you would normally say out loud and what you used to keep to yourself. You know, things like my mother's here with me today and she's never liked me, or my husband's here today with me and you know he's been cheating on me for 5 years but he doesn't know I know. Things that you would usually keep to yourself, but because of the situation you're in, you feel you share because your brain isn't telling you to keep that inside. Offshoot of people like this is just they're very, very talkative. We had a patient on Friday who had to sit in PACU recovery for a couple hours and he did not stop talking. He went on and on and on about his back problems, and just honestly there was less than a second between each new sentence. And these people can be some nurses will just treat this with certain medications like bigger doses of painkillers. The more painkillers you give someone, the sleepier they become, the more they stop breathing, because when you're sleepier and being unconscious, even though you've got pain post-ops, they'll give you something to treat that through your IV. Your body breaks it down very quickly, but when you, for the first 10 minutes in your system, it just really slows you down. You become like this, and you stop breathing as much. That's why often we have to give patients oxygen when they wake up. Not because they're not breathing badly, but it's just they almost stop breathing, they forget to breathe. So the most common phrase you'll ever hear where I work is couple deep breaths. Hey, take some deep breaths for me. You know, and people are, you know, they sort of like that. Now, we do get some very violent people who wake up. That's another form of recovery from anesthesia. This takes sort of 2 forms, physically violent and verbally violent. The physically violent does tend to be the much older population, older men usually. I've seen men who are 85 who've got the strength of like 8 of us have to hold them down. Their muscles are that clenched and they're just fighting with everything in their system. They will punch. You know, they will take. They're pretty slow. You know, they'll take a swing at someone, but you know the nurse will see it coming a mile away. They've caught a couple people. They've punched a couple people. Usually, when this happens, we call the doctor and we get restraints in order for restraints, so we can put restraints in their wrists and their ankles. Now, one of the common ways to get people out of this is just giving them enough pain meds to knock them asleep, and then pushing some Narcan, which is what you give overdose people. So people who overdose on like heroin, you give Narcan, it breaks down everything in your system, and then that wakes you back up. And doing that, like sort of pressing the reset button on the computer, it wakes patients back up, and often it's called the second wake up. They're fine, they remember nothing. The verbally violent tends to be older women. I've seen some old, lovely, white-haired ladies who look like the sweetest little old lady with the most foul and abusive language, the most obscene words, the most racial slurs. Again, I don't think they know what they're doing. I'm pretty sure they don't. This just seems to be a thing, and again, is often treated. Either you wait for a while for them to calm down, or the nurse just puts a bunch of pain meds in and then wakes them back up again, sort of thing. It's not nice Narcan, because obviously putting it in your system cleans you of all pain medication, so you wake up with a lot of pain. Then of course you just treat with a little bit more, you push a little bit more in, and you treat nicely. I have had some pretty scary stories of people waking up just different, like waking up, hallucinating, seeing really strange things, or thinking they're in places they're not. But the people who are the nicest are definitely the emotional gushers. They're like that all day too. It doesn't really wear off for an hour or two or so. But anyway, it's enough rambling from me. Have a good week, everybody. See you tomorrow.